Well, hello and welcome to Ask the Doctor. My name is Jerry McGee and I'll be the host for today's show. We're here in Pittsburgh, Pennsylvania with Wellness Associates and Dr. Eugene Goldberg. Dr. Goldberg, thank you very much for your time. On today's episode, Doc, we want to talk about really something that I think almost kind of summarizes everything we do on this show. We talk about a lot of different topics, but really it comes down to this whole thing of alternative medicine. I think people today are understanding that they're more than probably ever, that there are some alternatives. I think they're tired of the traditional approach to everything, and they're looking for some other answers. So what can you tell us about your approach and how that works?
Well, of course, the traditional approach is one cause, one cure. One cause germs, one cure drugs. Now, we get away from that. We say, Jerry, our philosophy, our model is many causes, many cures. We look at the diet, your lifestyle, your nutrition, and your structure. We know that your structure, Jerry, affects your function. If you have something in your spine like a vertebrae out of position, which is hard bone out of position, pressing on soft nerve, 10% of the time, Jerry, that'll cause pain. 90% of the time, it's functioning and performance, which goes to your cells, your organs, and your muscles. T4 affects your gallbladder. T8 affects your liver. C2 affects your sinuses. So what we do is we find the underlying root cause of your problem, why you have the symptom, and we try to fix it. We're kind of like DCs, Jerry. We're doctors of cause, doctors of cure, drugless care, drugless cure. We're also doctors of connection, okay? So if you do those things, 9 times out of 10, the patient is healthy. If you're healthy, you don't get sick. And what that means is the cure for all disease is just to get healthy. If you're healthy, germs can't attack you. It's sort of like the concept that if you have garbage in your kitchen, you're going to have rats. If you don't have garbage in your kitchen, you're not going to get rats. The rats, Jerry, are the scavengers. So therefore, we remove the cause of why you have the scavengers, okay? And then 9 times out of 10, healthy people don't get sick. You don't even get germs. You don't need antibiotics. You don't need cortisone. How do I know, Jerry? That's what I've been doing. I've been healthy for the last 6 years. I haven't been sick.
It almost seems to me, I know that these medical doctors go to school for many, many years.
Right.
I think they could really cut down the length of time if they just gave them a prescription pad and a couple prescriptions that you wrote every time somebody comes in to see you. Because
That's true.
Unfortunately, a lot of friends that I talk to, that's what it is. I mean, if I have a problem, I come to you and, you take my blood pressure, my height and weight, I tell you what the problem is, and you get out a prescription pad, and I'm on another drug.
That's it.
Okay? Very seldom does anybody in the medical profession really kind of get down to what the cause of my actual problem is.
That, to me, that's alternative medicine in the summary. We get to the cause of why you have the symptom. And once we get to the cause of why you have the symptom, we live in a cause and effect universe. So if you have an effect, you have a cause. We remove the cause, and once we remove the cause, the body heals itself. Do you ever hear that life heals, Jerry? The body heals itself. This is different than the medical model, which says you need antibiotics and cortisone for everything. Okay? It seems like dermatologists, mentioned medical doctors, it seems dermatologists as a role, they're real big on that. If you come into a dermatologist, my understanding, they give you an antibiotic prescription and they give you a cortisone cream. That's all they do. They don't ask, why do you have the skin problem? See, to me, a skin is a reflection of what's going on inside you. Is it an internal infection? It maybe could be a yeast infection, okay? It could become anything. Anything can cause anything, and anything can cure anything.
Yeah, because and I'm not an expert on all the drug interactions that are out there, but it just seems to me when you talk to some people who are on 6, 7 drugs, I don't really care what your training is. I don't know if you can ever truly gauge the interaction of all those drugs.
Nobody knows that. See, to me, Jerry, that's a disease in itself. There's a disease that's called polypharmacy. Did you ever hear of polypharmacy? Polypharmacy means many pharmacy drugs. If you're taking more than 3 drugs a day, that is a disease. It's called polypharmacy. Okay? So we kind of get away from that. I mean, that's why people come to me. The people come to me are having frustrations with the medical model. They're not getting the results. I had a woman call me this week. Her son's 7 years on antibiotics. What can she do? I said, well, you need to stop the insanity and bring him in so we can change the prescription. Now, when I say change the prescription, I mean natural. We're going to get him something natural. We're going to give him a second opinion. When we give him a second opinion, we're going to give him a conservative second opinion. We're not going to give him more drugs. We're going to try to find out why he has the acne. He's on antibiotics for 7 years for acne. Does that seem normal to you, Jerry?
Well, I mean, unfortunately, the way things are, yeah, that's a normal approach, but it's not something that I would see as if you're dragging something on that long on a medication, you've got to make some changes.
I think, and that's why she's calling me, because she knows something's not right in Denmark.
Yeah, I think too many, sometimes I think the problem is too many people put all their faith in, in that one doctor who, one, cannot be an expert on everything.
It's impossible.
Right? Can't do it. The other thing is, and I don't know if a lot of people understand this, they always say that by the time a medical doctor graduates, within the first year or two, most of the stuff that they've learned is outdated.
That's true.
And the reason when you're at a medical doctor's office, you see all these drug reps coming in. It's amazing when you're there. You probably see as many drug reps walking in and out of that office.
Do you know this for a fact?
Absolutely, I know it for a fact. One, I know it from a standpoint way back when I used to be in the therapy business and I worked with a doctor.
Right.
And then from a patient standpoint, I've been in medical offices and they just keep parading in, one after another. And also, a lot of the training that doctors get is from the drug companies.
Right. That's right.
And to me, it's almost like you need to kind of sever that closeness.
Conflict of interest.
Right.
Okay. So you might understand in medical school, that's all funded by drug companies too. So what you're going to learn in medical school is kind of, quote, tainted, where all the information they get is what drug are we going to give Susie or Janie.
Right.
It's not the diet, the lifestyle, the nutrition and structure, which is our model.
Yeah.
Okay, I'm going to encourage everybody listening to this to Google the cure for all diseases just to get healthy. If you Google that, you'll see an excellent article as a follow-up to what we're talking about. That it's true, Jerry. The cure for all diseases is just to get healthy. So if you're healthy, you can't be sick.
Yeah. And the other thing, I don't know if a lot of people understand this concept, but I think it's very, very true. When you look at these drug companies, and we can blame the drug companies all we want, they're a business.
Right.
Okay, clear and simple, they're a business. They could more than likely develop a drug that might help in a short, to cure something, say in a short term, but that's not a good business model for them. Their business model is
to treat you.
We want to get you on something that's going to be almost a lifetime drug versus a short term.
I'll give you two examples. High blood pressure drugs. When you're on a high blood pressure drug, if you're on coffee, they don't tell you get off coffee, they tell you get on the drug, and therefore you're on that drug for life. You never get off it. If you're on a cortisone, a cholesterol drug, which is a statin drug, once you get your cholesterol under 200, you're on that statin drug for life.
Right.
See, to me, you should get something, get it cured, and get off it.
Right. And that's one of the things that we want to stress to everybody watching this video, and some of the other videos we have coming up this month. I know we're going to be doing one on blood pressure that I think a lot of people, when we talk about this whole concept of the drugs and doing it without the drugs, I think is really going to be an educational thing for everybody. So make sure you're checking back frequently. We got some great videos coming up this month on a lot of great topics. But this thing of alternative medicine, I think one could really help to lower our healthcare costs in general.
Right.
If people would look at all these alternatives, and if for people watching this, I think it's just time that they say, okay, I'm going to take responsibility for my own health. I'm going to start to make my own decisions. Don't get kind of bullied into stay, because a lot of times, and I know this for a fact too, a lot of doctors get very kind of
pressure.
Get a very combative kind of personality when it comes to, hey, I'd like to get a second opinion, or I'm going to go see a chiropractor, and they're like, oh, they don't want to do that. And since we have a few minutes, let me just, because I used this once before, but I want to bring this up. Years back when I was back in high school, I had some knee surgery.
Right.
I had to have surgery. Went through that. I was going to an orthopedic surgeon. I couldn't get the range of motion, wasn't coming back. It just was painful. And my father was actually delivered to a chiropractor up in the Poconos in Pennsylvania. And he said to me, hey, this chiropractor thinks he can help you. Now, my thinking at that point was, what's he going to do? I just had surgery. I'm going through this process. They kept putting me under and bending my knee, and it was just painful. And finally, I gave in and I went. And this chiropractor looked at me from head to toe. Did some adjustments up in my neck, my back, my knee, everything. And here, what happened was the alignment in my knee was off, so that range of motion wasn't going to come back. When they kept bending me, it was just kind of aggravating me. So, I go back to the doctor, and he says, oh, finally, that last episode must have worked for us. And I had to tell him, I said, Doc, to be honest with you, I've been going to a chiropractor and have been having great results. And I think that was in my opinion, a great example of where everybody coming together and working together would have been an amazing thing.
Complementary medicine.
Right. And if it wasn't such a, that they didn't want you seeing a chiropractor and vice versa, because, they're arguing back and forth. If everybody was concerned just about my health, that could have been a very smooth transition.
Another example, this is kind of funny. Let's say you were driving a Ford, and you went to a Ford dealer to buy a Ford. What are the chances that the Ford dealer would say, Jerry, you know what? You should go across the street, go to the Chevy dealer. What are the chances that's going to happen?
Yeah.
That's kind of like medicine versus alternative, okay? And like a lot of decisions are based on what's good for the doctor, not what's good. Like there's a big controversy about stents. They're saying stents don't work. Edgar Snyder's on the case already because all these people had stents. It doesn't do anything. It's malpractice. They did it anyhow. So the patient's the one that suffers. They just did it just to build the insurance company.
Yeah.
Did you hear about that?
And I think one of the things that we want to stress, just so everybody kind of gets the right idea of what we're doing, we're talking about trying to bridge that gap.
Right.
We're not telling you to kind of just do away with your family doctor. We're just trying to say, listen, there's alternatives out there. If everybody works together, one, their best interest is going to be taken care of, which is really what this is all about.
Do the best of both worlds. See, my philosophy is do the conservative approach first. If you have a pebble in your shoe, try removing the pebble. If that doesn't work, take a Tylenol. Okay, if you have a fly on your windshield, use a fly swatter. You don't need a bazooka. So do the most conservative thing first. If you have a cavity, get it fixed as a cavity before you need a root canal.
Yeah.
Okay, so that's what we do. We can do conservative, non-invasive first. Okay, if that doesn't work, then we refer to orthopedic surgeon or the neurologist.
Right.
Okay, we do what is called a fingerprint exam here, where we look at your spine, Jerry, like it's a snowflake. And what that means, it's never before been seen, never to be seen again. It's a very unique thing. So therefore, we have to treat it as such. Every case is different. We have to do the neurological, orthopedic, range of motion, chiropractic tests, X-ray, determine exactly what's happened to your spinal dynamics. What kind of treatment are we going to do on you, Jerry? How long is it going to take? What kind of results are we going to expect? If you're not 40% better after 3 weeks, then we're going to refer you to somebody who can help you. So it's a win-win.
Yeah. It is a totally different approach, and that's just what we really want to stress to everybody watching. Pick up the phone, call Wellness Associates and Dr. Goldberg. Come on down. One of the great things that he offers, just so you can get a feel for what goes on down here, is you offer a new patient free evaluation. I mean, that's a win-win for everybody. Come down, meet the staff, meet Dr. Goldberg, see firsthand, what he can do for you. I think you'll be amazed at the results that you're going to see. So with that, we hope you enjoyed our video today on this topic of alternative medicine. I think it's a very important issue in the world of medicine today, and we hope that you'll start to think about all the different alternatives that are out there and things that can help and take your health and really have your best interest at heart. So thank you very much for watching, and we look forward to seeing you on our next episode.